Hello, and welcome to the Society of Anesthesia and Sleep Medicine podcast. I am your host, Cara Dupuis. I am very honored to be the chair of SASM's Communications Committee, and I practice pulmonary and sleep medicine at the Mayo Clinic in Rochester. Today, we are going to be talking about how to publish a manuscript, and I have two amazing guests with me.
I'm Dennis Auckley. I'm a professor of medicine at Case Western Reserve University in Cleveland and in the Division of Pulmonary Critical Care and Sleep Medicine at MetroHealth Medical Center, our county hospital. My career interest has been a lot dealing with sleep disorder breathing, particularly in the inpatient and perioperative setting.
Yeah, and I'm Tim Morgenthaler. I'm a professor of medicine at Mayo Clinic. I've, up until just recently, served as the director of the Center for Sleep Medicine here at Mayo in Rochester. I'd say most of my career has been, at least these last 20 years, has been focused around sleep medicine. And I have published in a variety of different ways around sleep medicine. Early on, I did a lot of practice guidelines. So that was a whole thing to learn how to do. And then I have my own clinical research agendas that I work on and try to publish in that area.
Thank you so much for joining me today. The topic of conversation is how to publish a manuscript. So I think you guys are going to be wonderful and very qualified people to answer that kind of a question. So I first wanted to start off with a fun question for you, or what I hope will be a fun question. Do both of you remember the first manuscript that you published, and could you tell me a little bit about that? So we can start with you, Dennis.
Yes, I do. Actually, it was in my fellowship, and it was a sleep article. So maybe a little late. Some people start publishing as medical students and residents, but it was a case report. That was a really just interesting case that we had noticed. A gentleman who had sleep apnea had undergone a renal transplant, and his sleep apnea seemed to have resolved with that. Did a search of the literature. There was really very little in the literature about that, and since we had pre and post testing, we decided to write it up, disseminate the information, and got it accepted. But it was a simple case report. So that's often how people get started.
Did you run into any roadblocks with that, or was it a pretty smooth process?
Well, being the first time writing a manuscript of something, of that nature, it was a bit of an undertaking, but I had wonderful mentorship, and they really helped steer me through the process, and selecting the journal, how much to really elaborate on our findings and the discussion, and it was a big learning process, but it was a lot of fun too.
Great. Tim, what about you? Do you remember your first published manuscript?
Well, the story I'm going to relate to you is a little embarrassing, but yes. So I was an undergraduate at MIT in engineering. That was my first field, was chemical engineering. And I was interested in that because there was work being done in bioengineering. And I had as a mentor Professor Dean in the Department of Chemical Engineering, and he let me participate in the development of a mathematical model that was going to evaluate the transport of solutes as they went through the renal medulla. So it was a computer model. This was a long time ago. And I worked on that project for about 2 years. And we were supposed to write it up first as a thesis and then on to publication. And I was having a very, very difficult time getting the computer program to work. I could get the solutes down into the medulla, and on the way back out, somehow the model always blew up. And I just couldn't, I was really getting very nervous, because if you don't write up your thesis, you don't graduate. And I really kind of needed to graduate because I had been accepted to medical school, and I had many, many sleepless nights. And finally, one night, the answer came to me, and I was able to get the program to work. But unfortunately, that left very little time to actually write up the thesis. And so that, and at that time, we did not have word processors the way they are now. A lot of it was typing. And so I drafted the thing, and I wrote it up, and I had it off to a typist and got it back. And unfortunately, with very little opportunity to proof it with a rested mind, if you understand what I'm saying. I was very, very sleep deprived. And I handed it in. And of course, it was absolutely brilliant work. You know that. But as it
Obviously.
turns out, where I had intended to talk about the prior model's erroneous results, somehow all of my erroneouses ended up being felonious. So they were not only errors, but they were felons. And so it was a very embarrassing first publication with all kinds of felonious errors in it. So that was my first publication of sorts. My first medical publication was less traumatic because my thesis advisor had a he had a heyday with that. But my first medical publication that I can recall was actually a manuscript retrospective review of the causes of death in patients who had had fatal pulmonary emboli and just kind of how they had actually been coded. And it was a retrospective review of about 100 to 130 autopsy cases. I had a great mentor. He kind of walked me through the process of putting it together and then writing it. And it was a very good, very positive experience, in large part because of my great mentor, Dr. Jay Rue, who is still a friend, colleague, and mentor to this day here at Mayo Clinic.
Wonderful. Thank you so much for sharing that. That's a pretty priceless story, I think. So you guys both mentioned good mentorship as being part of what can make for a successful publication. What other things do you think can set you up for success, or do you want to elaborate more on the mentorship idea?
Yeah, I would say mentorship is a really big part of it. So, if you're doing a project, whatever the project may be, if it's a review of the literature, a chart review, a prospective study, really having someone that has experience in the area that you're working in, someone who's recognized in the field ideally, that's extremely important because they help set you up for the success and getting something accepted. That they give you advice all along the pathway from developing your idea, really honing things down, deciding what's important, what's not important. When it gets to the writing phase, how you write a medical paper. Again, trying to keep things organized, focused, really on the key findings of whatever your project is. And then helping you along with selecting, the correct manuscript, which is also extremely important. The correct journal, which is extremely important. They always talk about aiming high for journals. Sometimes that's appropriate, sometimes not. And your mentor can help guide you with that and picking one that gives you the greatest chance of hopefully having it accepted, with the realization that oftentimes it takes multiple submissions to get a manuscript in the medical literature.
Yeah, Dennis, I really agree with you on that. I think as I think through now, learners that I'm, hopefully mentoring appropriately, I think obviously, Carrie, it obviously helps to have a good topic. Hopefully you've chosen a good topic and you have some interesting results. Hopefully you're thinking about publishing something that, where you do have something to say and something to share that's going to enlighten the reader or contribute to the field. It's a building block. But assuming that that's true, I do think there's a lot of strategic choices that need to be made. And without a mentor to help maybe the first few times through that, it's hard to know exactly how to approach that. But I would say one thing is, really start thinking before you start writing, who is going to be your audience? Who is the target readership? Are you in sleep, for example, we're often thinking, is this really mostly a sleepish thing, or is this kind of sleep pulmonary, or is this, more general cardiovascular pulmonary neurology? Really kind of identifying who your readership is, clinicians, researchers, policymakers, and then, you're going to want to use that information then to the next thing that Dennis mentioned, which is really finding that appropriate set of journals that might be receptive, that where you're going to find those readers reading in those journals. And I have learned some tricks over the years that might be helpful to people. Of course, you got to think about the scope and fit. Eventually, maybe not in your first iteration of your strategy, think about the impact factors and so forth. But I think there are some useful online tools now that can help you, kind of find the journal fit. If you already have sort of an abstract of what you're going to publish, maybe you have it left over from submission for a presentation at the sleep meeting or chest or wherever it is. If you take that and put it in, for example, there's one free online tool called Jane that it basically uses AI and will take a look at your abstract and your keywords, and then it'll kind of say, oh, here's a list of journals that publish things that look like yours. And along with that list, it shows you sort of the journal's impact factors and how many articles like yours might get in. So it's kind of helpful to use tools like that. There's other tools that are available for free. Elsevier has a journal finder. I haven't always found that one as helpful. Springer and Wiley, these all have online tools that can be a little helpful if you're just trying to kind of get some ideas of where would I end up submitting this manuscript. I think it's a good idea to do that kind of early on. At least you have to have some content first. Of course, the articles that have been informing you as you write your journal article or your manuscript or your research, look and see where those have been published, because those are probably the places you're going to maybe also want to be thinking about landing your manuscript. So I think that's a strategic thing. A practical thing that I also would just recommend early in the writing process is have the hard discussions about authorship. Usually you're not the one writing alone, and you hate to get kind of very far in the manuscript writing process and then learn that you have some real battles on your hand. It's not that you're going to be able to nail down the author order right away because you don't yet know who's going to all contribute and how much. But I think at least having those discussions can be helpful. And those there again, if you're early on in your career, that can be very daunting, and that might be something to get your mentor's help with. But I think it is an important step. I don't know if you found that to be true as well, Dennis.
Yeah, for sure. Particularly, projects that may take some time where you get multiple people involved. As you mentioned, often at the start of the project, you think, oh, it's just going to be the 3 or 4 of us. And then by the time you're done, it's 8 or 9. And, really having those discussions early and as people are brought into the project is a good idea. You'll save yourself a lot of headaches down the road. Just to jump back, one other thing I think those tools you're recommending are great in terms of selecting a journal. But sometimes, so off of that and discussions with your mentor and colleagues, you can often come up with a sort of list of journals. And sometimes it's not always entirely clear. One sort of old-fashioned thing that I've used in the past, which I found to be helpful also, is as Tim mentioned, you have your abstracts or outline of the study. Send a cover letter in the abstract to the editor of the journal or section editor. And get their feedback. Say, hey, is this something you guys think you might be interested in? They're obviously not going to accept it based on that, but they'll may give you some, oh yeah, this is a topic that we'd like to see the full manuscript. Why don't you submit it? Or this probably isn't really appropriate for our audience. And sometimes they'll even give you suggestions for other journals.
Yeah, that's
so reaching out sometimes can save you a little bit of headache and time, just because the review process can take a while. And so that sometimes can get you a little one step further. But yeah, so the tools that Tim mentioned, though, are fantastic, and I would strongly advocate for that as well.
I don't always find that they give me spot on what I want, but it gives me some thoughts. Sometimes it kind of prompts me to think about, well, where is this going to fit the best?
Yeah, and sometimes something pops up there that you didn't necessarily think of right off the bat. So yeah.
Yeah, those are great resources to think about. So the main things I heard you guys talk about were, finding a good mentor, making sure that you have a couple of journals that the topic would be appropriate for, finding a compelling topic that is relevant and that you think people want to know about, making sure that you know who the audience is. And then, other things, looking for, other similar articles and where they might be published, using online tools, and then talking about authorship early. So I think that's a great list of things to think about when you're starting up. And, this is a lot to consider. Why should you be publishing? What are the reasons that someone should want to publish manuscripts? I guess what could you expect it to do for your personal growth or growth in your or advancement of your career? What are your thoughts about that? And what do you think that you have gained from publishing things over the years?
Yeah, so this is almost so true as to be, stamped in on all of us. The old adage of, see one, do one, teach one. Well, I find that when I participate in writing a manuscript, or when I'm writing a manuscript, boy, that's when those ideas really get solidified in my mind, and it usually causes me to reach out much more broadly about the topic that I've been thinking about. I learn a lot by reading what other people have written and thought about, which then makes my work, I hope, better. And then as you begin to actually write, that's where I find that the ideas become clearer. Hopefully, they become clearer because as you're really trying to reorganize things and decide, well, where does this fit in the universe of knowledge about this topic? How does it relate to those things? I think that makes us better able to contribute to our field. It makes us better able to think about how to serve our patients or our colleagues, because you're really just becoming part of that community.
Yeah, I agree, and I would echo all those sentiments, and then I would just add on a couple other things. I think for me, sort of finishing a project and getting something written up and published, there's obviously some personal satisfaction with that, right? So you get you've done something, you've contributed, you've got a publication out of it, and I think that's big, particularly for people earlier in their career. It is kind of a boost for your own self-satisfaction and eventually career development. As Tim mentioned, also I think you really just the process of doing it, you learn the literature, you also learn who's in that field. And I think that gives you opportunities to sort of network with people, because oftentimes you'll present, as Tim mentioned earlier as well, you'll present your findings at a meeting first, and you get to meet folks who have overlapping interests. And that really can lead to a lot of personal and career growth along with that. You're going to make new friends, potentially future collaborators, networking. And from a career standpoint, it often opens up opportunities down the road. Getting involved, someone may recall, oh yeah, I met so-and-so at a meeting and they had an interest in this area, and we're going to develop some guidelines, or let's do a review and let's get them involved. So I think that can really go a long way towards helping with your career development, just getting that name recognition, and the participation in the field. So yeah, I think there's multiple reasons, both personally and professionally, why publishing is a good idea.
Yeah, and just kind of jumping off of what Dennis mentioned, this feeds back a little bit to our initial part of our conversation of thinking about where you want this manuscript to be published, because again, there's a part of this that's about sharing what you've learned and sharing what you know and contributing to patient care and contributing to the field. And there is always a part of this also that's a bit personal, in that you want to get the most bang for your buck. You want to get the most enhancement of collaboration and visibility, so that you can learn from others even more. And so as maybe you came up with 4 or 5 different journals that you thought might be a good fit for your particular article, because that it's going to get to your audience. Then you have to start kind of thinking about, well, is this likely to get into that journal? Is it the right kind of article to get into that journal? And then you do look at things like, well, what's the impact factor? Not that I don't know that impact factoring is the right terminology, but when I see that, I think about, yes, how often are others going to read this article and maybe end up quoting it in theirs because they thought it was an important building block in their knowledge base. I think that's kind of how I think about the impact factor.
Great. Yeah, thanks for those insights. Now we've talked about some of the general things about writing manuscripts, but I actually wanted to talk about some details as well. So, when you have a manuscript and you've, found your journal and your topic and your mentor and everything like that, do you have a specific approach that you use? And, for instance, do you do the abstract first, or do you do it last? Is there a section that you would recommend starting with? Or, how would you recommend approaching some of these things? Because writing a compelling introduction, writing a thought-provoking discussion, those can be difficult sometimes. And so do you have any sort of system that you use when you're thinking about that?
Yeah, I guess I'll go first on this. I think there's multiple probably approaches to doing this. It may depend upon the person, the topic, how your mentor likes to do things. Um, but for me, at least, oftentimes, as we've discussed already, you sort of have an abstract together you may present at the meeting. That's often a good outline to start with. The introduction and methods section usually is fairly straightforward because often, most of the time you've submitted your project for IRB approval, and so you've had to write all that up already. I think the key thing once your study is done is just to make sure that those are still valid. You didn't adjust any of the methods. Make sure the introduction is appropriate but succinct. It can be easy to get carried away writing too much there. But really kind of coming to the focus of what your primary hypothesis is. The results are usually fairly straightforward because you've collected the data. I think the biggest thing there is mentors will often tell you is not to go overboard with including too many results in there. Really focus on the novel, primary, or interesting finding from the study. And then the discussion kind of flows from there. And at least personally, I find it helpful to sort of build an outline for that, where you, with some important points that need to be covered. So, it's reasonable to reiterate a little bit the results, but you don't want to go, spend too much time doing that, just regurgitating what people just read. The main reason to do that is to put it in the context of what is already out there in terms of the existing literature. How does this result fit into that? Does it move the field forward? If it's a different finding from what's been reported, why is that? If it's similar, what are you adding? And then, trying to expand upon that a little bit. And then, it also generates, and then an important issue there is also recognizing your limitations. You need to be honest about those up front. No study is perfect. There's always limitations to studies. So you want to make sure that that's acknowledged, and that will save you a lot of time when it comes to the reviewers as well. And then kind of, wrapping up with, what are sort of next steps? What questions do the results of my study raise? Future directions, and sort of the concluding segment. So I guess that's kind of how I think about things. I don't know if Tim has a different approach.
No, I think our approaches are very similar. I would just add, when you're, as you mentioned, when you're designing your project and you're having to go through an IRB or something like that, you usually, hopefully, you've already been able to articulate why you think you should do this study, and that's kind of your first version of an introduction. And methods, similarly, hopefully you've already thought through that. I like to start thinking right away there with, okay, what are my results going to look like? And, generally speaking, for a lot of these, you can already start envisioning, well, there's going to be a table 1 that's going to have kind of demographics about who are the people in the study. And there's going to be a table 2 that's starting to look at whatever the covariates that I was thinking about. And one of the reasons to kind of be thinking about the results as you're designing the methods is because you want to make sure that you're gathering all the data that you're going to need before you find out that, oh, dang, we forgot to record the BMI on everybody. You have to go back and do all that again or whatever. So just kind of thinking ahead as you're doing the work is, I think, very important. Then I've tried to learn this for myself, and I try to advise, fellows that I work with. When you get an opportunity to present that work because your abstract was accepted as either a poster or a podium, be very curious about what people think. Ask them questions. Engage those people, because those people are going to give you a gift in those discussions. They're going to be seeing this material for the first time. And the kind of questions that they ask are the things that are going to end up in your discussion. When they question your data, when they are thinking about, why whatever you're telling them isn't true or might be true, or when they're thinking about what that means, engage with them in those conversations, because they are giving you a gift. It's a total gift. First of all, you're making great relationships, you're sharing, you're having fun. But my habit has been immediately after those, I go and I take a mental dump of everything that they said and I write it down, because that stuff there are little gems that you can use when you go to start writing your discussion or even your introduction, because sometimes they've mentioned to you another reason why it's important that you did this work. So just kind of mentioning that longitudinal approach to thinking about the end when you're going through this work, I think can be important. I do generally, when it's time to sit down and write it, I do start by writing the introduction again. I don't start by writing an abstract. I start by looking at that introduction, as you said, validating that it's still accurate, current, up to date, but really trying to kind of put the framework on, how clearly can I state why this is important to do this work and what we're looking for, because that will kind of, it's almost like you're setting up the whole rest of the article then for how the person is going to work through your findings and how to interpret them and how to place it then in the context of the existing medical literature. And like Dennis said, like, well, what might be next because of this?
And I'll just add on one thing, just to reemphasize what Tim said there just a minute ago about making sure it's very clear, simple, and straightforward. That's what reviewers and readers appreciate. Getting off on flowery language and over explaining things often is a disservice. So really trying to keep the writing crisp and clean, and that takes practice and often mentorship to help learn that process.
Great, thank you. Those are that's amazing advice, and I love what you said about at the abstract presentation, picking people's brains at that time and trying to anticipate what other people are going to ask about it. We talked a little bit about reviewers. That came up a few times in this last bit of conversation. So what advice do you have for dealing with reviewers and responding to reviewers? It's often, I think, the scariest part of publishing. And so what advice do you have in that respect?
Well, so I'm not necessarily in this order, but I want to make sure I have an opportunity to say this to people who may be listening to this. Become a reviewer. Become a reviewer. And the reason I say, I'll never forget, the first time that one of the senior staff here came to me as very junior. I probably was here on faculty for like 2 weeks, and they came to me and they said, hey, would you be interested in reviewing? And I didn't know what to say because I didn't know if I felt capable or competent to do that. And I think now you can also invite a fellow to co-review with you as long as you can get permission from the editor and so forth. I think that by being a reviewer, two things happen. First of all, boy, do you begin to learn how to do things better and how to do things worse. Because when you're reading the literature and these early drafts critically, you just learn a lot. And it's also a chance to get a little further. You're seeing things, probably at least 6 to 9 months before they're published. It begins to get your brain spinning a little bit faster in your field. But the other thing it does is it puts you in the mindset of the reviewer. Because if you're being a reviewer, I think you'll find you're trying your hardest to be helpful. You're trying your hardest to be reasonably critical and articulate about how they might improve the manuscript or how you think that might not quite be right. And then when you get the critiques from the reviewers that come back, you can just kind of have a little bit more empathy, and you can say, oh, okay, so I need to not take this personally. I need to, if I'm taking it, I need to put it in the dress drawer for a little while, take a little holiday from it, and come back, because they're people just like me. They're trying to provide recommendations or opinions about what's been written, and their comments, once I can get in the right frame of mind, again, are going to be my best friends. They're going to be very helpful to making that manuscript better in all likelihood.
Yeah, I couldn't agree more. I think I've learned so much from being a reviewer over time, and it's something to get involved with early. You really get a different perspective looking at it from the other side. And one other thing I would highlight with that is, as Tim sort of mentioned, reviewers' jobs are to give you a fair critique, be honest, but they're really trying to make your manuscript better. You always have to keep that in mind when you get the feedback. Sometimes it is very easy to take it personally. Oh, how could they think this? And or maybe it's a misunderstanding or whatever, but they're always doing it with that goal in mind of, can this paper be better? What's missing from it? What needs to be added? What should you take out? And that's usually the mindset of the reviewer, because they, even if it ends up being rejected, you should still take that information, put it in the context of your manuscript, and revise it for submission to a new journal. It will make your paper better. Yeah, definitely agree with those comments.
Thanks. That's great advice. And I have to, that brought up a story that I remember, Tim, when we were mentoring me on a paper during fellowship. I remember we got feedback from the reviewers, and I was a little bit demoralized because there was just a lot of feedback. But I remember after I had responded to all of it and edited the paper, I just kind of took a step back and was like, wow, this paper is so much better because of this feedback. And ever since then, I've not been so offended by feedback I've received, because I do feel like it is truly something that can make your paper a lot stronger. So
Yeah, I mean, sometimes you do get a reviewer who is, no matter how hard you try to overcome your pride, you just can't feel like it's being useful to you, and that's, I guess that's the breaks. But I think most often reviewers are trying to contribute in their way to the same goal that hopefully we're all working on, which is to produce better and better information. I will say the irony of having this particular discussion today fell on me very heavily this weekend. About 1 week ago, I submitted a manuscript, which I personally thought was a very good manuscript, to a journal, and I got a refusal. I got a refusal with a rejection with no comments, actually, which means that it didn't get past the editor's desk. And the fellow that I worked on that project with, he was not happy, let's just say. And I kind of had to counsel him. I mean, I'm not happy about it either, but I said, it's a little bit like when you're starting dating. Just because the other person didn't like you doesn't mean that you're bad. It just means that you didn't have what they were looking for at the moment. You sometimes just have to go find a second date to go on. So
that's
a great analogy.
Yeah, exactly. All right. Well, do you guys have any other advice for people, or are there any topics that you wanted to touch on that we haven't discussed yet?
I would make just a couple other quick comments about sort of reviewers and submission. So one is, oftentimes they ask for you to mention who you might want to review the paper. And so that's a good place where colleagues and mentors can be very helpful. A lot of people are networked, know people in the same field, and they can direct you to someone that they know is going to be, fair but honest with you. As Tim mentioned, sometimes you can get some reviews which may seem a little too personal, and so there are maybe some people you want to avoid if they have a reputation in the field, but they're few and far between. But if you have the option of picking a reviewer, get some advice on that. And then just one other comment, sort of separate from the whole reviewer issue, about the submission. We've talked about picking a journal before you submit, and while you're initiating the writing process, look at the journal's requirements. They often lay out specifically, word counts, how it needs to be organized, and it's different for different journals. So spend some time reviewing that before you actually delve full head on into writing the manuscript. It will save you a lot of time and headache later, how the references need to be formatted, et cetera. That's all very, very important. And then finally, before you submit it, make sure you do just a simple, good English grammatical typo review.
you don't have any felonious errors.
Yes, exactly. You think that Word would catch a lot of things, but sometimes they don't. And so, from the reviewer perspective, it is something when the journal's expecting things to been read through. If it comes through and you're like, what are they saying with this sentence? It's there's two connected sentences that don't make any sense, or something like that. And so you want to make sure all those minor things, your results are lined up, they're consistent throughout the paper, your discussion is consistent, all that. So I think those are key points I would keep in mind also prior to submission.
I agree with all those things. I guess the two things that I might add, one is, most of our manuscripts in medicine do deserve tables and/or figures, and it's worthwhile really thinking about your tables and your figures. I find that there's a lot of errors, in the proofreading. Sometimes those don't get proofread as carefully as the manuscript, but more importantly, more is not always better. How can you simplify? The tables and figures should really ideally simplify your results in a way that can be easily digested. So just putting down every single detail in a table that goes over 3 pages or something like that is not likely to be received well by the reader or the reviewer. And so, even if you really need all that detail, put some thought into, well, is there a simple version of this that I could put in, and then maybe the more details belong in a supplement or something like that. So just really thinking through what information it needs to be in those tables or figures. Figures usually are more graphical representations that are more easily digested by the brain. So sometimes it's a good idea to think about what's your main result, and should that be presented in a figure rather than a table, just because it's easier for somebody to grasp it right away, and it's going to flavor how they read the rest of the manuscript. So that's just a 2 cents worth thing. There's a guy that wrote a lot about graphical representation. I think he's got like 4 fabulous textbooks. I think his name was Tosti. Does that sound right, Dennis? Tosti or Tosti?
Sounds right. Yeah.
Yeah. Tufte. Yeah. Edward Tufte. Sorry, I had it almost right. Yeah. And it's worthwhile just grabbing one of those and reading through it. It's fun for one thing. It's really fun reading.
Well, I really appreciate both of you joining me today and giving everybody such wonderful advice about publishing a manuscript. And thanks so much for your time.
Thank you, Kara, for having me.
Thank you for having us. Appreciate it.